For many Americans, this is the food shopping experience. It takes place in a store close to home and has a large variety of options, including healthy fruits and vegetables. But for the citizens of Baltimore, where 23% of them live in poverty, access to food such as that does not happen. Most shop in corner stores and liquor stores, and even get a lot of their food from fast food areas such as McDonald's.
Looking everywhere.
I have right behind me what we call our food environment map. So this is a deep look into where it is in Baltimore it's hard to find healthy food. So we define a food desert as an area where you're more than a quarter mile away from a grocery store. You're in an area with low vehicle availability, so it's hard to drive to the store, or you may not have a car. You're in an area with high poverty, so even if you don't have a car, do you have the means to be getting to a grocery store? Do you have the means to be spending a lot of money on food?
Food deserts may be the root cause of many negative health outcomes. In a 2015 report, Baltimore City food desert areas showed an almost 200% higher rate of premature death due to cardiovascular disease. They also showed that the life expectancy of those citizens living within food deserts was drastically decreased.
So our post solution is a solution that was launched in Rhode Island about 5 years ago and that has some legs in the DC area, and that is the Fruit and Vegetable Prescription Program, FVRx. And how the prescription program works is that a patient with a diet-related illness will be enrolled by their healthcare provider in the program. During this visit, they will set goals and discuss individual nutrition programs as well as the importance of healthy eating. They'll also receive an FVRx prescription during the visit, and their healthcare provider will collect certain health indicators associated with their diet-related disease. With this prescription, the individual can redeem fresh fruits and vegetables at farmers markets and grocery stores. So if you're a family of 4, you would receive $1 per family member per day of the week, so $28 a week. This $28 is often matched by current matching programs that exist at both grocery stores and sometimes supplemented with WIC or SNAP benefits. Every month, the participant will attend a clinic in which they will receive nutritional education, conduct maybe some exercise classes, and receive their new prescription, as well as set goals for new eating with their healthcare provider.
Being able to prescribe fruits and vegetables, to be able to prescribe going to the farmer's market is a really powerful one because it gives physicians more power to help patients take wellness into their own hands. A lot of the power that physicians have is often on the reactive side. And in working with healthcare centers, a lot of what we hear from physicians is that they want to be able to be providing more resources for the patients that they work with, but a lot of the time they don't even know where to go. So the concept of being able to write a prescription is really powerful because that's something that physicians do every day.
Value proposition: to improve diet-related illness with regular health check-ins, nutritional education, guided exercise classes, and affordable fruits and vegetables. Our program will provide coordinated care to food insecure families in West Baltimore to better allow them access to nutritionists, primary care providers, and fresh fruits and vegetables. Based on the 23% poverty rate in Baltimore City, we estimate there are up to 145,000 people who could be considered food insecure. Additionally, with 21% of the population under 18 and 83% of Baltimore public school children eligible for additional food assistance, there's approximately 108,000 children who could be considered food insecure. To be eligible for this program, a family member will also have to be at risk for cardiovascular disease, such as diabetes, hypertension, obesity, or a higher incidence of stroke. We will launch the program by looking at food deserts in West Baltimore and coordinate that with locations of public elementary schools in the same area. We will identify 3 elementary and middle schools in Year 1 and 5 elementary and middle schools in Year 2 in West Baltimore that would have a higher population of food insecure families in order to launch the program. The potential school sites are listed here, and our hope is to target 30 families in Year 1 and 50 families in Year 2, with up to almost 500 people being served through this program. The Executive Director will have primary oversight of technical and operational staff, and the technical teams will have specialties in community outreach, food access and clinical coordination, and policy and advocacy work.
The program logic model for the FVRx program shows us the resources we will use, such as a list of clinics and hospitals serving low-income patients in Baltimore, along with a list of farmers markets within Baltimore and their days and hours of operation. The activities consist of creating the FVRx enrollment form for patients, along with the FVRx voucher card itself. We'll also distribute this material and promotional things such as brochures and one-pagers passed out at participating clinics, hospitals, and farmers markets. The outputs will consist of the number of clinics, hospitals, physicians participating in the FVRx program, along with the number of patients that participate in the program. We'll also look at the amount of vouchers that are distributed to each patient, along with the amount of vouchers used by these patients. Our desired outcomes will include improving patient knowledge of healthy eating habits and gradually helping these patients lower their body mass index. And after 4 to 6 years, our long-term goals are to have full participation of all Baltimore farmers markets, along with 500 participating patients. The overall impact of the FVRx program will create healthy eating habits that will improve mental and physical health. It will help manage and combat high cholesterol, hypertension, heart disease, and diabetes among patients. It will also increase sales of participating farmers markets by 10%. Along with a 90% patient satisfaction with FVRx over 5 years, we also hope to have 1,000 patients served by 2025.
The monitoring and evaluation plan will look at 2 things. First, it will look at prescription usage and reimbursement for each family enrolled on the program on a monthly basis. Second, it'll look at changes in health indicators for families enrolled that suffer from diabetes, obesity, heart disease, and/or hypertension.
Our business model is inspired by DC Greens and Wholesome Wave, all of which empower underserved consumers by increasing affordable access to locally grown fresh produce and by improving food education and policy. The model partners with healthcare providers, local farmers markets, and small retailers, and provides nutrition incentives to consumers with limited access to healthy foods in their own neighborhoods. 60% of the program's income is supported by major donations from corporations and foundations, 25% is covered by large government grants, and the last 15% is covered by individual donations. However, to increase our competitive advantage specific to Baltimore, our program proposes 2-tier events that will add financial diversification. One is community cooking classes led by local chefs who already participate in economic development and community revitalization. Such chefs can be found at places like Our House, a restaurant incubator and food hall opening in Remington this fall. The other is an annual food festival bringing local celebrity chefs, small retailers, and farmers market vendors together for a day of education, entertainment, and celebration of seasonal produce. These special events will not only bring in an additional profit, but also will be used to build momentum that expands impact on tackling the issue of the current food system.